The following program was recorded at the 2018 National Medicare and Senior Insurance Product Sales Summit held June 12th in St. Louis, Missouri. To access other videos recorded at association conferences, go to www.medicaresupp.org/library. The American Association for Medicare Supplement Insurance maintains the nation's #1 online lookup for consumers searching for local Medigap agents. For details on getting listed, visit the association's website. Now, enjoy the program.
I'd like to welcome you all to the Associated Medicare Supplement Conference. We're going to be talking about Medicare Advantage and prescription drug plans here today. We're going to be talking about the prescription drug program and how it is affiliated with the Medicare Advantage programs. We're also going to be talking about other items, merging Medicare Advantage legislation. We're going to have compliance in this room. We're also going to be talking about tips and tactics for success, how to effectively target Med Advantage prospects, and so on throughout the afternoon. So I want to welcome you all and thank you for coming out to our meeting today. My name is Anthony Barr. I'm the Vice President of Marketing for Jack Schrader and Associates, and we're here as the platinum sponsor for this event, and we're very pleased to be here today. Want to let you know that we're going to have this session recorded. You can watch that at the MedicareSupplement.org library from all the tracks. So even if you missed some of the other events in the other rooms, you'll be able to go back and view some of those other events today. So a little introduction. I've been in the Medicare industry for over 11 years, sales and marketing for over 14 years, and a background in sales and marketing has brought me to the forefront of the JSA marketing team, allowing me to distribute and work with agents nationally. We're based out of Green Bay, Wisconsin, which is our national headquarters, and have offices around the country, which we'll talk about later today. So we're very excited to get started with our CE session, and we'd like to keep things on time today. So I want to thank everybody for coming into the room. And we'll go ahead and get started. Everybody should have a handout. It's going to be a color copy of today's presentation for the continuing education. So I'm going to ask you to go ahead and follow along with that because there's a lot of numbers and statistics that I'm not going to read off the screen. I'm going to explain what they mean. We're going to try and keep things moving. There's a lot of information that we're going to cover today. As you know, the Medicare Advantage and the Part D programs, very large in scope. So what we do ask is you remain in the room for the entire session. There's going to be a sign in and sign out sheet that will be coming around. So we're going to ask you to go ahead and sign in. We're going to wait for you to sign out until the end of the program. At the end of your handout, where the presentation is, there's also something called the Affidavit of Personal Responsibility. Each and every one of you need to complete that form in its entirety and turn that in at the end of the show. If you don't turn in the affidavit and you do not sign out, we cannot give you the 2 credits. Okay, so it's very straightforward. So again, affidavit, sign in, sign out, remain in the room. Please silence your cell phones. Doesn't bother me, but courteous for the other folks in the room. We certainly do appreciate it. So with that said, we'll go ahead and get started. So Medicare Advantage, we'll talk about the brief history of Medicare Advantage and really the network-based program that it is today. So back in the early 1900s, the first type of HMO, or managed care program, was actually out in the state of Washington, in Tacoma, in 1905, and there was actually the first per member per month fee to be a part of a network-based type program, and this was for loggers, was 50 cents. Okay? So when we move up to the 1960s, and we had Johnson, President Johnson, and we had the Medicare Reform, in 1965, we had Dr. Paul Elwood. He helped design some of the parts of the Medicare Reform, termed the coin phrase of an HMO, or Health Maintenance Organization, and the first offering of these plans were offered in the 1970s. As we move into the 1980s, we saw the first form of the Medicare Advantage program that we have today in a Medicare risk program designed for seniors on Medicare to lower their costs. That first year the plan was implemented, there were over 500,000 people enrolled into this plan. So again, this was assigned in 1982 by President Reagan. And by 1997, there were over 5.5 million people on this program. And we saw the Balanced Budget Act under President Clinton change that program to the Medicare Plus Choice program. Okay? We saw a degradation in the program. There was funding cuts, there were changes to the program, and we saw a lot of people drop out of the Medicare Plus Choice program. It actually fell to 4.5 million from its peak of 6.5 million. So the program was faltering.
If you'd like to watch the rest of this program, as well as benefit from watching all sessions recorded at the 2018 National Medicare and Senior Insurance Sales Summit, go to www.medicaresupp.org/sell more for access information.